Welcome back to the podcast. We have Dr. Nicole joining us today. She is a naturopathic doctor, and we're excited to pick her brain about all things fertility, natural health, and wellness. So welcome to the show.
Thank you so much. Thanks for having me.
Absolutely. Well, to kick it off, could you give us and the audience just an idea of your background and what led you to specialize in hormonal health and fertility as a naturopathic doctor?
Yeah, sure. So let's see, I went to naturopathic school and was kind of led down that road, I guess, both because my mom was a massage therapist and my grandmother was a massage therapist and a reflexologist. And so I was getting like Reiki and massage and reflexology for like my ear infections and things like that as a kid. And they're definitely healers. So maybe I inherited some of that from them. I worked in hospitals and nursing homes a bit in like high school and college, and felt like something preventative was missing. So that led me to naturopathic school. And after naturopathic school, I did a 2-year residency at a primary care clinic in Vermont, and then stayed at that clinic for 2 years. So it's wonderful. In Vermont, we can be primary care docs, which is awesome because we can like fulfill those needs while also giving a naturopathic twist to it, which is very cool. But at the same time, you find yourself being a bit of like a jack of all trades and maybe not a master of none, but I was feeling like what kept walking in what's interesting actually is that when I was in school, I didn't think I would specialize in hormonal health. It felt confusing to me, and it is confusing.
Yes.
And then when I was in primary care, I was primarily seeing women, and I realized that like everything was coming back to hormones constantly. So I kind of couldn't look away from it. It was like even things that seemed very unrelated to like the menstrual cycle were coming back to it in a lot of ways. So it kind of found me, and I just kept seeing it over and over again that I needed to focus more on it, and that also people wanted more than kind of what they were getting conventionally. So I started my own practice about 4 years ago, and it's allowed me to hone in a lot more on just on focusing more on hormones, which has been awesome.
That's so awesome.
Yeah.
That kind of, thinking about hormones as being confusing and stuff kind of reminds me of, this has kind of been like a meme going around, I feel like, where people be like, I could like walk into the ER with like my arm hanging off and they'd still ask me the date of my last menstrual cycle. And there's just like this kind of frustration around it. And, knowing what we know now, we're like, okay, well, it's the 5th vital sign. It is something that's really important to your overall health,
Right.
but there isn't that awareness. And do you see like maybe more in conventional medicine, but there's kind of like a disconnect between asking that question and then providing care centered around that? Do you feel that way?
Yeah, for sure. And I think that a lot of women are feeling it, and they're hungry for like more information and a shift in the approach, but they're just like, they know that it's out there and we see a lot on the internet, but then it's hard to know who to trust and how to advocate for yourself. So yes, I think it's definitely there.
Aside from that, like, do you think what else is lacking, like in the standard conventional approach to hormonal symptoms and fertility?
Yeah. And I always say to my patients as well, like, there, for a lot of reasons, I think the conventional world is wonderful and beautiful, and there needs to be this happy medium. I can't do surgery to like remove an ovarian cyst or anything like that. So I'm grateful for them. And I think that a lot of the conventional approach is like more of a one size fits all. So when it comes to hormonal symptoms, like whether it's PMS or irregular cycles or acne or heavy periods or painful periods, like everyone's getting a lot of birth control. And I think that birth control can be like a wonderful thing to prevent pregnancy if that's what someone needs. But I think that there's frustration, and rightfully so, that that's being handed out for the solution to a lot of a lot of hormonal concerns. And then there's also the group of women who are wanting to get pregnant, and so they want to be comfortable with their symptoms while they're gearing up for that part of life. And then on the fertility side of things, similarly, it's like if there's infertility, sometimes there's a really obvious reason that can be treated, but otherwise, if you fall into this camp of unexplained infertility, which is a lot of folks, then we're left with IUI and IVF, and it's kind of like the digging deep isn't quite there for either, and the treatments are a little bit more cookie cutter. And I think that patients, folks, women are realizing that we're all very much individuals, and you want a little bit more of like an individualized, holistic approach, and they deserve it.
Absolutely. Yeah. The whole like fertility intervention thing is so great. I know a couple people that have had to go through that process, and it's long and it's difficult and expensive. And it is really wild to hear that they're not getting advice of, simple natural things they could do to support their fertility, especially when you hear that like fragrances aren't allowed in fertility clinics, right? Like they make that a rule, but they're not giving their patients any type of education around that.
Right.
It just seems like so disconnected.
I know. Yeah, it does for sure. And it's a time thing. I think that there's not as much, unfortunately, the way that the medical system set up, visits are short, and some of those docs could be offering more, but there's also not a lot of time to chat through all the foundational stuff. Yeah.
So could you maybe give our listeners an idea of like, you're speaking about the time that you get to spend with a patient. What would be the difference that you see between a conventional care visit and a visit with you as a naturopathic doctor?
Yeah, I would say in a nutshell, two things. One is the time is, being given 15 minutes, and some conventional docs are spending more than that for sure. Whereas myself and a lot of my colleagues, like my initial visits are anywhere from 60 to 90 minutes, and my follow-ups are anywhere from 30 to 60 minutes. And that's somewhere that range is, I think, pretty standard for most naturopathic docs. And the other piece, I think, with the conventional world is that we're looking at things in a bit of a silo. So, you go to the OBGYN to talk about your hormonal stuff. You go to the dermatologist to talk about the acne. You go to, the cardiologist to talk about your heart, and the GI doc to talk about GI stuff. And our goal with natural medicine is to kind of like look at that whole person and do a little bit of detective work around like many of these things are likely connected. And how do we, like, sometimes when I'm doing work on the hormones, it turns out that like we actually have to turn and look at the gut a lot and do a lot of gut healing before we can, before our supplements and interventions to work on hormones are going to work. So yeah, it's kind of like that more holistic, like root cause approach, I think, that sets it apart as well.
Everything's connected.
Yeah.
I wanted to ask you, because I heard you say in the beginning that you were not originally intending to kind of specialize in hormones, but then it just happened because as your clients were coming in and walking through the door, you were realizing that things kept coming back to hormones. Were there specific diagnoses or health conditions that you saw, and what were they? And was there any one that was like super surprising that it came back to hormones?
Yeah, definitely more of like the run-of-the-mill ones like acne and hair loss and
Right.
mood stuff, anxiety, depression, and then headaches, which might be a little bit less surprising. Things that were really surprising was like eczema outbreaks or psoriasis, like that kind of more like immune system type thing where and sometimes it was the patient coming to me and being like, oh my gosh, I've been experiencing this for all these years. And I just realized after we started like watching the cycle or tracking it or writing it down, this is happening like not just once a month, but like at the same exact time of my cycle every month. And sometimes, and initially it was me who was like, oh, wow. Okay, I'm so glad you noticed that about yourself. And now I'm trying to be the one who's encouraging patients to see. I'm often looking to see if there's like something cyclical to those concerns that people walk in with, where maybe they haven't noticed that it's linked to hormones. But yeah, I almost feel like you name it, we've seen it be linked. Yeah.
Yeah.
While you were saying that, I was thinking about how crazy it is as women that we're so conditioned not to connect things cyclically with our bodies, like things like fatigue and mood swings, like, oh, I'm just like really, really tired, don't know what that's about. And then, oh, of course, like your period is coming. And now, as we've become more educated about these things and like understanding those hormonal fluctuations, it's just like, duh, like it makes so much sense. Like we're just on this revolving wheel, but we've been so disconnected. So do you find that most of your patients are really open to taking that cyclical approach, or do you get like some pushback of people that are like, I don't want to have to deal with that kind of thing?
Yeah, I think that where my practice is at now, a lot of folks that are coming in, already noticing that like something's there. A lot of people are coming to me, like, oh my gosh, I realized this, and then I reached out for help. Sometimes, and then there's that other percentage where they're coming in for XYZ, and it's not as clear, and they think there might be something hormone related, but we have to do more of that detective work. Sometimes folks have like this really strong gut feeling that there's something linking it to the hormones. There's not a clear pattern. So yes and no, but most people are pretty open to taking that dive, for sure.
That's a really great tip for listeners. Like a practical application, a way to partner with your doctor would be to write down your symptoms, whether it's eczema, acne, and track it for a few months and bring that to your doctor and show them, because, the partnership between doctor and patient goes both ways. And so everyone has to do their homework. And I think that's a really great, like, applicable strategy for anyone listening who wants to get to the root cause of what they're dealing with.
Yeah. Yeah. I think you're right. It's like one question that gets asked a lot is like, how do we advocate for ourselves better? And I think you're right. It's like being prepared for those conversations, to just hit the ground running a little bit more if you've done some of that detective work. Yeah.
Do you see a lot of patients that are coming to you as like second, third, fourth resort, and they're kind of been beat up by the system, struggling to get answers, like they've been struggling to advocate for themselves?
I do. Yeah. I see a handful of, I now have everyone in my practice that comes in, do like a quick little, we do a meet and greet and we make sure that it's a good fit. And I hear that a lot during those meet and greets, just like, a little bit lost, a little bit discouraged, sometimes a little bit, like resentful or jaded or whatever. And I do feel like my job, I really try hard, to, restore some of that trust in not just like natural medicine and win them over, but also, try to also support their experience overall, even for the conventional side of things, if that makes sense. But yes, definitely there's some distrust, there's some frustration coming in. Yeah.
Do you have any advice if somebody is listening and they feel like they're in that situation? Like, would you just say seek out a naturopathic doctor? Or are there other steps that they could take?
Yeah, I mean, I think what Caroline said is great, to like really pay attention and do some of that detective work, journaling. I mean, it can be hard work, but it's like we all have pretty much smartphones now or computers where we can easily jot it down or put it in the notes section or in our calendar. A lot of folks have like period tracking apps and things like that. So I think being your own detective, like you said, and getting all your questions written down before going in. And yes, seeking out naturopathic care, and also like adjusting our expectations a bit, where like I love my OBGYN. She's absolutely amazing. She's super evidence-based. But she said to me when I went to her complaining of like painful periods and some of the things that I was struggling with hormonally, she was like, are you using your tools? Like, I have for you birth control. And it's just like a difference in the way that we were trained. And I think, recognizing that and having some compassion for that. Like a lot of what folks will say to me coming in is, I went to my OBGYN and they didn't want to do any labs initially on my hormones. And I think it's just two different lenses. It's just the way that we're trained, two different lenses to look at labs in that more functional way versus that the standard of care is more to move towards, birth control or whatever. So it's fair to be frustrated. And it's also just like two different backgrounds. Yeah.
Speaking of birth control, I know you kind of mentioned before that you believe that it has a place, somebody is really trying to prevent pregnancy. Is there one type that you would favor as being like the least harmful to the system that you kind of recommend your clients to? I know not everyone is a fit for everybody, but I'm curious on your thoughts.
Yeah, well, I do certainly recommend fertility awareness method. And I love if folks are able, and I know that's part of your background, that when folks are able and curious and wanting to take that step, it's wonderful because if it works for them logistically, and they want to, put in that effort to learn how to follow that method, I think that then we get like an added bonus of birth control being really ready to be able to conceive if that's what we want down the road, and collecting so much data about our cycle. So those are the folks, like the women who are already doing some cycle tracking or fertility awareness method. They're the ones that are coming in being like, here's all the data, which is like very cool, bringing their charts to me. And then aside from that, the copper IUD is non-hormonal, but unfortunately it's not the best fit for everyone because it can make periods more painful and heavy. So that's just a bummer. I always say that like the one non-hormonal thing that we have, it's not without this risk that we might, it might worsen our symptoms. And we never really know until we try. And for some folks, not everyone loves getting an IUD placed. And I think maybe after that, the hormonal IUDs, and then maybe after that, the implant and birth control pills. Yeah.
Good to know.
Yeah.
So we were talking about lab work, and from a functional perspective, if someone say they prefer to go to a doctor and use their insurance, or they want to work with a traditional doctor, are there labs that our listeners could like request that you would recommend?
Yes, definitely. Let's see. I think two things are important. So if we're going to run labs through a conventional lab and try to run it through insurance, I can do that here where I live in Vermont. But if I'm working with folks out of state, we have to sort of like try to approach them and ask. And I usually give a list of, should I just list them out? Like my general little list. I would want to look at estradiol, testosterone, progesterone, LH, FSH, DHEA sulfate, and a thyroid panel. I know that was a lot I just rattled off, but that would be like the starting point. And I think a really important takeaway message that I don't see happening in conventional medicine is it's really important that we time those labs. So it's important that we get a certain set of those labs, estradiol, LH, and FSH, on the earlier side of our cycle, like day 2 to 4. And that we're getting progesterone between days 19 to 21. The other ones don't matter as much. And there's some nuances there depending if someone has a really irregular cycle. It's not that textbook, but I see folks coming in all the time with labs. And they're like, I got these labs done, but my provider says it doesn't really tell us anything. And I'm like, when did you have them done? And they're like, I don't know. I just like went in one day and had them all done. And I'm like, well, hold on. Like I can't really even, like, we can sometimes take it with a grain of salt if I'm like, okay, this was day 14, but really the way that we like to interpret them is at these specific parts of the cycle. Testosterone doesn't matter as much, but I always tell people, like, if you're coming in with labs that you've already had done, I'm happy to read them and interpret them before we redo everything from scratch. But if they weren't timed well, it's trickier to interpret them. Yeah.
Okay. That's a really important thing that I think a lot of people don't realize.
Yeah. Yeah, for sure.
Yeah, I've definitely spoken to people too, where they're like, well, I got these labs done and they said it looked fine. I'm like, well, what day did you test it on? Because your hormones are always changing. All of that matters.
Right. Yeah, they are.
We're complicated.
Yeah. And that's why I also really love the Dutch test. But the Dutch test is a dried urine comprehensive hormone test, and it gives us more information about also like our detox pathways and how we're moving everything through and different metabolites. But it's an out-of-pocket test, so different than a lot of conventional docs. aren't trained to interpret it. So it doesn't always like translate over if we bring it to our OBGYN and say, can you take a look at this? Yeah.
One of the perks of having someone that is trained to look at those, because those tests are so comprehensive. Right? It gives you everything.
Yeah.
So kind of speaking about hormones and fertility, when should someone start preparing for pregnancy? Like how far out should somebody be thinking about how they're prepping their body?
Yeah, this is like $1 million question. I'm like, from the day we're born. No, I'm just kidding. Too much pressure on. I think that ideally 3 to 6 months out would be awesome. I think the sooner the better. And what I tell folks is that whether you want to get pregnant like tomorrow or yesterday or 10 years down the road, it's totally fair to come in and say, I know I want to get pregnant someday. And like, what are some things I should be thinking about? Because everything that we do to prepare for pregnancy is helping us have healthier hormones and helping us be healthy all around. So there's really no time too soon to come in and start having the conversation if someone's curious. And I think, in the conventional world, and I did this early on in my practice, I did the same thing where it was like, just start trying and come back and see me if you're not pregnant in 6 months or 12 months. But for folks who are curious about the information and want to support their bodies, and they know that they want to be able to get pregnant when they start trying, the sooner the better, really, because we are born with all these eggs that we have for the rest of our life. And then those eggs undergo, they undergo stress, from whether it's mental stress, emotional, immune stress, environmental stress. Like they're susceptible to all of that. And so the more we can kind of like love them sooner, the better we can support that egg quality and fix any hormone imbalances and get ourselves to a better place nutritionally. Yeah.
So bare minimum 3 months.
Yeah, that's the long answer.
So no, I think that's great. And so if you have a patient that comes to you and they say, I do want to get pregnant in 3 to 6 months, where are you starting with them? Like, what are the first steps?
Yeah, I try to talk to everybody about there's some very foundational things that like we can all do starting tomorrow in our household, in our homes, and the way that we kind of like move through our day-to-day life. So I talk to everyone about that. I'm certainly talking to folks about environmental exposures and regulating their blood sugar, stress management, getting better sleep, going through diet with a fine-tooth comb, and then really looking for the individual at what's going on with their hormones. Do we need to do some work to dig deeper, get more information so we can support them to be in better balance, and then making sure everyone understands like where their fertile window is, so that they're trying at the right time as well. And I also always encourage, I'm seeing a lot of women in my practice, that we don't forget to consider like the other side of things, the male counterpart. I see a lot of women who are like, let's get me ready. And it's like, okay, let's get everyone ready. We take on a lot, I think, as women when it comes to this part of the journey. And we are more complicated. There's more hormones, there's more organs, there's a lot more going on, and we're housing this pregnancy, but we also can't let off the hook the other side.
There's another half of the equation.
That was literally my next question. Like, how often does it spill over into the partner and like them actually needing to address things that they are so integral to the whole process?
Yeah.
Can't do it without them.
They are. I wish that more couples came in together, or that more of the other side was establishing care to work through things. Sometimes I do, and sometimes it's just more like by osmosis that we're planting some seeds. But it's huge. The male fertility is very important. And what's always so interesting to me is that like semen analysis parameters have changed a lot over time. And we've slowly adjusted them, like through whether it's the WHO or whichever organization you're looking through that normal, what we call normal today, actually wouldn't have been normal, 40 years ago or whatever it was. Don't quote me on that, but we're always readjusting those parameters to, fit what the bell curve, what the standard population is showing. So that's where, when I look often at normal semen analyses, where they could be better, they're normal, but they're not optimal. So yeah, I think like sometimes having another set of eyes and looking through it with a functional lens is really important. And there's a lot we can do to support male fertility as well, like very research based.
Yeah. So, I mean, obviously for all humans, like reducing environmental toxins and having a good diet is really important. But for men specifically, when it comes to sperm quality, is that increasing testosterone? Is that what it comes down to mostly?
Yeah, sometimes we're increasing testosterone and looking at testosterone levels. I think we're also doing a lot of like work with supplementing with nutrients to help with whether it's like motility or morphology or sperm count. Talking about diet, we know a lot about the effect of pesticides on sperm quality. So we're talking a lot about trying to go organic where we can, see what's for folks. It's not always easy to just like overhaul and for everyone to go organic overnight. I don't eat everything I eat is not organic, but between there's some herbs we can lean on, there's some nutrients, and then sometimes we are looking at the male hormones as well and testosterone.
So then once the woman gets pregnant, the couple gets pregnant, how are you supporting the fertility journey throughout the pregnancy?
Yeah, great question. I'm happy to meet with couple. I love to meet with them once a trimester, but as much as they need to meet is wonderful. As you may know, there's like a window after we get that positive pregnancy test to when we see the OBGYN, which can feel like excruciatingly long. There's a lot of questions that come up in that time, or maybe not feeling well first trimester, and actually just having someone to touch base with when you might not be telling family and friends yet, and you haven't seen a doctor, and you're in this limbo period. So that's when I see folks the most. And then some people aren't feeling as well in the beginning, so we do what we can with nutrition, and what we know about. We know how important it is to build a microbiome in a baby, like build up good gut health. And we know that that nutrition in pregnancy is very important in influencing the baby's microbiome. There's also little things that we can do in like the second and third trimester that are very easy, like with fatty acids and probiotics that can help prevent things like eczema and asthma and allergies. There's like so much that we can do during pregnancy to support mom and to help have a healthy baby too.
Yeah, I can imagine having like that additional support from you makes such a difference, or from, any naturopath, even just for normal visits, getting into the OBGYN, you can be waiting. Yeah. Waiting and waiting for weeks to get that appointment. So having like a team really is helpful. And in terms of a team, like what else do you suggest as support during a pregnancy, birth, postpartum?
Yeah, I love, oh my gosh. So I love prenatally. I do love fertility awareness specialists. We have one here in Vermont who's really so important in our community, but I always tried to find folks who will work with other people when I'm working with out-of-state folks. Love my pelvic floor PTs for postpartum. They're a big part of my referral network. Acupuncture for sure. And we have I see so much movement with acupuncture paired with naturopathic medicine for both like all of the hormonal stuff, painful periods, endometriosis, PCOS, and then also for fertility and getting pregnant. And luckily, we've got a lot of fertility clinics now, like bringing acupuncturists in-house so they can do acupuncture before and after IVF treatments and things like that. So it's moving in a good direction. And dietitians, I think it can be great for us at all those different stages to chat with a dietitian and see how we can kind of like optimize nutrition and blood sugar. So yeah, who else? There's probably more, but that's the quick list. Yeah.
Great. Well, I think that's super helpful. And I know now, as we are recording this, you just returned from your maternity leave, correct?
I did. Yeah.
congratulations.
Thank you.
And I think, I'm not a mother yet, but from what I hear from my friends and from other colleagues and things around me, it seems like that postpartum period is maybe a little bit underserved. Into like, there's so much focus on the preconception time and then the pregnancy. And then really we have this fourth trimester afterwards. And I'm just curious, kind of what was your experience? What are things that helped you? Maybe what would you have done differently, or would you do differently in the future?
Yeah. My second time around, this was my second child, and my second time around was definitely very different from my first. I knew how to set myself up a little bit more for success. The first one, knowing everything I knew, being in primary care, seeing people go through it, knowing how you have to reach out for help. It still felt hard and tricky, and it was hard to know what was normal and not normal, and what you power through and what should be expected and what you reach out for help with. So I think that I would love to see everyone postpartum like a couple weeks out, and I would love to encourage women to kind of like schedule those visits as much as they can. Like, think about who you want to see for pelvic floor PT, think about seeing your therapist, think about as many of those visits as you can have lined up, and know the people that you're going to lean on, both like medically and then your village is just really, really, really important. And I think that we need to, and from my perspective, I think whether we're dealing with periods or whether we're trying to get pregnant or whether we're pregnant or we're postpartum, it's very easy in the conventional world to say, you're tired. Maybe it's perimenopause. Maybe it's just because you're pregnant. Maybe it's just because, yeah, of course you're tired. You're postpartum. You're not sleeping. And it's like, well, let's check your thyroid. Let's check your ferret. Let's look at your labs. Let's look at your iron. Let's check your vitamin D. Like, you are tired because you're not sleeping and you're stressed. But perhaps we could, take the edge off the fatigue or anxiety or depression if we caught some little, like nutrient deficiencies that we could support. So, yeah, I'd love to catch everyone when they're a couple weeks out. And I'd love for all women to be intentional about like planning that village medically and socially, so they have everyone to lean on. Yeah.
Well said.
Yeah. Thank you.
Well, what are a few things that our listeners can start doing today that would really support their overall health? I mean, Caroline and I really believe that your hormones and your overall health are intertwined, and that's what you said before too, but what can we start doing to support our hormonal health, our overall health, our fertility?
Yeah. Yes. I love this question, and I could rattle off like a million things, but I won't. So I try to keep it short, but I think that the going organic really is huge. We know a lot about the impacts of pesticides on fertility and hormonal health. And to take that one step further, I think that eating whole foods as much as possible. I think that a lot of what's going on with just like health and the way that people are feeling overall, but especially with hormonal health, is like putting food in our body that our body can't recognize. So trying to watch out for the additives and preservatives and some of the more inflammatory foods that are out there. So that's a big one. From an environmental perspective, yes, the going fragrance free. I mean, it's huge. Fragrances and the phthalates are known endocrine disruptors. So like wherever we're at in our hormone journey, if we have hormones, which is everyone, male, female, postmenopausal, children, to avoid those endocrine disruptors is hugely impactful for our hormonal health and longevity. So that's a big one. I tell folks that the environmental working group is like such an incredible resource to check your beauty products and your cleaning products and your home products to see just how clean they really are. And if we need fragrances, we can lean on products with essential oils in them or essential oils themselves. Environmental working group is also great to help us if we want to go organic, but we don't know where to start or we can't afford to overhaul everything and go organic. Their like Clean 15 and Dirty Dozen list is a great place to start, to be like, okay, how can I invest money in this but not break the bank? Getting 5 servings of your fruits and veggies a day is huge to get that big, and and all the colors of the rainbow really is the goal. Because those antioxidants really our ovaries need those antioxidants to build those hormones and support egg quality. And I'll do like 2 more. One would be blood sugar regulation, regular meals, getting plenty of protein at every meal, getting enough fiber. That just sends this, I would say stress management, but it's like, we know that, but another part of stress management is regulating our blood sugar, because when our blood sugar is steady, we get that safety message to our nervous system. And when our nervous system doesn't feel safe, and there's a lot of things in this world that can make our nervous system not feel safe, it's like we will divert resources away from hormones and fertility and reproducing. So the more that we can send that safety message to our nervous system, whether that's getting adequate sleep or, not overcommitting and saying no to things at work, and managing our blood sugar. I think that's one that we forget when it comes to the adrenals and stress management. Blood sugar is a great way to manage those, the stress response. So that's my short list.
That's excellent. Those are all of our favorite tips too. I love it. So it's been so great chatting with you, Nicole. Where can people find you? How can they work with you? Give us all the details.
Yes, thank you. So I'm very uncreative. So the name of my practice is Dr. Nicole Kearney. My Instagram handle is just Dr. Nicole Kearney. My website is just drnicolekearney.com. And like I said, I see folks in person in Vermont, but I also see folks anywhere else really through telehealth. So happy to work with anyone who's, needing the support and really curious about this stuff, because I absolutely love it. Yeah.
Excellent. Well, we'll be sure to link all that in the show notes.
Thank you.
And I actually do have one more question, because you mentioned earlier that Vermont is one of the states where you as a naturopathic doctor can practice primary care. Are there any other places in the country where that is also true?
Yes, it's more of the exception than the rule. Let's see if I could do this. Oregon, Washington, California, we might not be able to be primary care, but we're definitely getting closer. And I do believe we can bill insurance and maybe prescribe in California. Oh, this is, my fellow naturopaths would be disappointed. New Hampshire, Massachusetts, I do believe we can now bill insurance. Where else am I forgetting? Arizona. And I hope I'm not leaving anybody out. Yeah, it varies a lot state to state. What I think is tricky about folks like understanding our medicine is that, like, I'm from Pennsylvania, where we can't bill insurance, we can't prescribe medications as naturopaths, we can't order imaging or things like that. And here in Vermont and some of the other states I mentioned, we can practice like exactly the same way any other MD can, essentially. And then there's some states in between where we can do some things, but not all. So yeah, it's a bit of a mixed bag state to state.
Mm-hmm.
We can work
kind of a short list.
Yeah.
But if working with somebody in person is really important to you, you could probably Google that and get some information pretty quickly, right?
Yes, totally. And there's and when we work with folks, in states where we're not licensed, we're working more as like a health coach.
Okay.
Yeah.
Good to know.
Yeah.
Well, thank you so much for sharing all of your insights with us today, Dr. Nicole, and we'll talk to you soon.
Awesome. Thank you so much for having me.
Oh.